For, well, decades, we've pretty much measured healthcare by what happens inside a hospital. But what if the most important work, the stuff that really matters, happens outside its walls? There's this powerful realization reshaping the entire industry. To truly heal people, you've got to look beyond the clinic doors. And that's exactly what we're digging into today. So, this really is the big question, isn't it? The one at the heart of a massive shift in how we think about health. I mean, if treatment inside those four walls is just a tiny piece of the puzzle, how do you even begin to address the rest? How can a hospital possibly influence a patient's access to healthy food, or their job security, or even how safe their neighborhood is? It feels huge, right? Well, that's the exact challenge a new manual for healthcare leaders is tackling head on. Okay, so the very first step is making this huge shift in perspective. It's kind of like zooming out with a camera. We're moving away from that micro focus on just one patient and their treatment, and we're zooming way out to a macro focus on the entire community they live in. It sounds simple, but it's actually profound. A person's environment plays an absolutely massive role in their health. And what's super interesting is how this breaks down. What is that environment? Well, according to the CDC, it's these 5 big categories. These are the things that truly determine health outcomes. And look at them. It's not just about whether you can see a doctor. It's about the quality of local schools, the stability of your income, even the safety of the street you live on. This quote from the manual it captures the whole paradigm shift perfectly. The medical community has realized that the community impacts a patient's health more than the treatment they provide. Wow. Think about that. Healthcare is realizing that to be truly effective, it has to become a major player on a much, much larger field, the field of community development. And if that quote didn't convince you, check out this number. 4 out of 5. 4 out of those 5 big determinants of health we just looked at, they all fall under the general umbrella of community development. That's literally everything except direct healthcare access. So the bottom line is, well, it's pretty clear. Healthcare just can't go it alone anymore. Okay, so what's the solution then? What are we supposed to do about it? Well, the new approach isn't for hospitals to suddenly become experts in housing or economic development overnight. That's not realistic. No, it's all about becoming a powerful strategic partner within the community and doing it with a really clear two-pronged strategy. I love this slide because it just lays out the transformation so clearly. On the one hand, you have the old model, reactive, treating sickness, acting alone inside its own 4 walls. But then look at the new model. It's proactive, focus on building health, and this is key, partnering with the community. It's a total fundamental change in the mission. And that new mission, it really rests on these 2 key pillars. And it's so important to get this. It is not about top-down solutions. It's about 1, empowering the neighbors, the actual people who live there, to become leaders. And 2, it's about strengthening the local organizations that are already on the ground, already doing the work. This is all about building on the assets a community already has. All right, so that all sounds great in theory, right? But how does this actually work on the ground? How do you do it? Well, the manual provides 2 really clear, really actionable frameworks to turn this whole strategy into something real. So for empowering neighbors, it's this simple but super powerful model. Organize, train, and plan. First, you just help people connect and form groups, right? Get them talking. Then you give them the training they need, leadership skills, how to run a meeting, that kind of thing. And finally, you help them create a concrete, actionable plan. And that plan is what gives funders and other partners the confidence to actually invest in their vision. It's pure capacity building, right from the ground up. And for strengthening the organizations already there, the approach is just as strategic. Understand, consult, and invest. And this is so much more than just writing a check. First, you have to build a real relationship to understand what an organization truly needs. Then, you bring in a dream team of experts to help them build up their skills in strategy. Then, and only then, do you make that strategic investment. That way, you know your resources are going to have the absolute maximum impact. All right, so we've got the frameworks. We know how to empower neighbors and strengthen organizations. Now, let's zoom back out a little and look at the high-level principles, the kind of rules of the road that guide this whole thing. This is what makes sure these efforts are actually strategic and not just a bunch of random, disconnected projects. And here they are. These 5 principles are basically the guardrails for success. You've got to focus your resources, use data to make your decisions, take a real leadership role, be willing to make major investments, and, this one's critical, tackle the problem from multiple angles all at once. So let's dig into a couple of these a little more closely. So, that first one, the focused area approach, this is so key. Think about it. Trying to solve problems for an entire city just dilutes your impact until it's basically invisible. But if you concentrate all those resources in, say, a 40-block area, you create real, tangible change that people can actually see and feel. And that is what builds momentum, builds trust, and makes people believe that progress is actually possible. And to be truly data-driven, you need tools like this. It's called a Geographic Information System, or GIS. The easiest way to think about it is like a super smart map. It lets you layer all this public community data, things like crime rates or housing conditions, right on top of your health data for a specific area. This lets you see hotspots and connections you would totally miss otherwise. And crucially, all the patient health information stays completely private and secure behind the hospital's firewall. It just allows for a really, really targeted response. Okay, so we've talked strategy, we've talked principles, we've talked tools, but what does this all look like in practice? Let's connect these big, high-level ideas back to some actual, tangible projects that can start making a real difference in a community, like right now. And here is where it all comes together. You can see on this slide how specific, real-world projects connect directly back to those social determinants we talked about at the beginning. A workshop for small businesses? That directly addresses economic stability. A neighborhood walking group? That builds social and community context. Each one of these projects is a piece of a much larger, coordinated response designed to lift up the entire community ecosystem. And that really brings us to the final and I think most crucial question. This isn't just some new trend, It's a whole new frontier for healthcare. It demands a completely new way of thinking, of acting, of partnering. The old model of just staying safe inside the four walls, well, that's just not an option anymore. So the real question is, who's ready to step outside and lead the way?